Good morning, dear students. In today's session, we will be discussing about shock. Shock, it is otherwise known as circulatory failure. So, as a complication of many diseases, we have listed the name shock. So, in cardiovascular, blood disorders, and GIT disorders, in all situations, one complication may be common, that is shock. So, in today's class, we will be discussing what is shock and details of shock. Hope you listen properly. So, shock, we can define that it is a complex clinical syndrome characterized by inadequate tissue perfusion to meet the metabolic demands of the body, resulting in cellular dysfunction and eventual organ failure. So, maybe any reason may be different and organ affected may be different, but here the common finding is inadequate tissue perfusion. So, inadequate perfusion, so that the body is not able to meet the demands, and that affected organ or cell is undergoing cellular dysfunction and eventual organ failure. In some situation, multiple organs will be affected, and in some situations, some selected organs will be affected. So the problem is inadequate tissue perfusion, and that is resulting in cellular dysfunction and the organ failure. So this is the definition of shock. So you have to remember that is a circulatory failure leading to organ failure. So in different areas we have listed the complication of shock. So we can see what are the types of shock. The first one is hypovolemic shock. The causes of hypovolemic shock may be blood loss. So in last day's session we have seen hemorrhage. So profuse bleeding is known as hemorrhage, and if it is leading to a profuse blood loss, it can lead to hemorrhagic shock. It is coming under hypovolemic shock. Again, in plasma loss, like fluid shift in burns and in other situations, we have discussed that increased capillary permeability and leads to plasma loss, which leads to hypovolemia. So in that situation also we can see hypovolemic shock. Another reason in hypovolemic shock is extracellular fluid loss. So in gastrointestinal disturbances or diseases, you might have learned about vomiting, diarrhea, especially you get diarrhea. In these all situations, what happens is the child is losing extracellular fluid, and that also leads to hypovolemic shock. So this is the first classification or the first type of shock, hypovolemic shock, and the main causes are hemorrhagic or blood loss, then plasma loss, extracellular fluid loss. So these all causes contributes to hypovolemia and results in circulatory failure or hypovolemic shock. Hope you understood. So the presentation of the patient or the characteristic of hypovolemic shock include: there will be reduction in size of vascular compartment. The vessel, the compartment which is inside the vessel, that is the blood volume or blood size will be losing, or volume will be coming down. Falling blood pressure will be the poor capillary filling. The extremities will be very cold and clammy. Then low central venous pressure, and the pulse also very feeble. So these are some of the characteristics of hypovolemic shock. So the causes are clear. Many of the conditions already we have discussed, and it leads to these all characteristics in hypovolemia. Next type of shock is distributive shock. Distributive shock, it is causes are anaphylaxis, like allergy or hypersensitivity to any substance. It can be a drug or any substance in the nature. So next is sepsis and bacterial toxins, like a septic shock can be there. Then loss of neuronal control, that is neurogenic shock, especially in a spinal cord injury, we can see this type of neurogenic shock. Next is myocardial depression and peripheral dilation, like exposure to anesthesia, barbiturates, opioids. So this leads to myocardial depression and peripheral dilation and leads to distributive shock. So there is abnormality in the distribution of blood to different organs and leads to distributive shock. And the causes are anaphylaxis, sepsis, neuronal reasons like spinal cord injury, myocardial depression and peripheral dilation. So these are the causes of distributive shock. So the characteristics of distributive shock include reduction in peripheral vascular resistance. So the backward flow will be reduced, and profound inadequacies in tissue perfusion. So tissue perfusion, capillary perfusion will be lost, and increased venous capacity and pooling. So in extremities there will be edema formation or the pooling of blood can be seen, acute reduction in return blood flow to the heart, and diminished cardiac output. So these are the characteristics. So peripheral vascular resistance will be low, the back flow of blood from extremities and other organs will be low, so there will be cardiac output will become low, and this pooled blood will be seen in the venous area, like extremities and other veins will be pooled with blood. So these are the characteristics of this distributive shock. The third type of shock is cardiogenic shock. So cardiogenic, in the term itself it's very clear, something related to heart. So the causes especially in children are after surgery for any congenital heart disease, the child may get cardiogenic shock. Primary pumping failure like congestive cardiac failure, myocardial trauma, myocarditis. In this whole area, we can see cardiogenic shock, and another reason is dysrhythmias like SVT, AV block, etc. So these are the causes of cardiogenic shock. So the main characteristic is decreased cardiac output. So pulse rate will be low, blood pressure will become low. So these all manifestations can be seen, or the characteristics can be seen in case of cardiogenic shock. So this is about the types of shock, and we have seen that mainly there are three types of shock, and under that there are different types of causes which leads to shock. So hypovolemic shock, then distributive shock, next is cardiogenic shock. So next what we have to discuss is pathophysiology, that we will continue in the next video. Thank you.